Recently, we've been seeing a lot of reports about complications and sometimes even deaths happening with cosmetic surgery all over India. While this is very unfortunate, this is something that our patients ask us. Doctor, what are you doing to keep us safe? What are the safety precautions you have in your hospital? So, I wanted to record this video to show you at the Venkat Center how we take safety very, very seriously and what all we do to keep you safe when you come to us. I'm Dr. Aniketh Venkataram, plastic surgeon, the Venkat Center for Aesthetic Health, Bangalore. Now, to start off with, I would say that we look at safety of the patient in three different ways. One is how can we be safe before surgery? Second is how can we be safe during surgery? Third is how are we safe after surgery? Now, the thing to understand about safety is all about preparing for the worst. It is avoiding the worst and preparing for the worst. You don't prepare for the best. When things go well, there is no problem. You prepare for the worst. And all these preparations, you hope that you never have to use them. So in that sense, it is a waste of resources. You're spending money on something that you're hoping you don't use. But it is still important. And this is where people cut corners. They think, oh, this thing will never happen, this complication will never happen. But that's not the way to be safe. You have to prepare for every eventuality. So starting with before surgery, there are two things you have to do. One is you have to do the right surgery for the right patient. You have to check and make sure the patient is a good candidate for this procedure. You should not be too aggressive. At the Venkat Center, we don't believe in doing multiple surgeries in one day. That increases risk, that increases complications. We believe in staging procedures where required. We believe in only offering patient the procedures that is a good fit for them. Many times patients ask us for procedures that we actually deny them. And this is an important part of staying safe during surgery. The other important part, so first was the right surgery. Second is the right patient. We have to make sure that the patient is fit enough to handle the procedure that they require. This typically involves conducting some investigation, some blood tests and other tests before the surgery. We have a more detailed video on this that you can look at. So, we don't operate on an unsafe patient. If we feel that the patient has any issue, we get that issue sorted out before we plan any kind of surgery for that patient. We have even cancelled surgeries the day before surgery because the patient developed a cold or a cough and we don't want to go ahead when the patient is having some other illness. So this is again things that as a doctor, it is important for us to take this responsibility and not push things where they are not required. Again, cosmetic surgery is an elective surgery. We lose nothing by waiting. It is not a surgery that has to be done with any kind of risk. It is a surgery that has to be done in a most optimal manner. Now, let us have a look at our rooms and our operation theatre to see what are all the safety precautions we take during and after surgery. So now, let us take you into our state-of-the-art hair transplant facility to see the safety precautions we have going inside for our hair transplant procedures. So here we have dedicated rooms for PRP and this is our hair transplant surgery facility. We have two dedicated hair transplant operation theatres and here, this is our state-of-the-art hair transplant facility. So here what you can see is apart from the usual stuff that you see for hair transplant, this room is sterilized as if it is a major OT. So all sterility precautions are done as if we're doing a major surgery. That is one thing that is important during surgery to make sure the OT rooms are sterilized. We have a dedicated CSSD which we will show you, which is where we sterilize all our instruments. Now within the OT for safety, we have oxygen and suction lines, so that if any emergency is done, it can be dealt with immediately. We have a defibrillator. That is that if any patient is having any cardiac issues, we have this on standby. We have never used this even once in over 4,000 surgeries, but we still have it. We make sure it is charged and ready for every single case. This is what I mean by safety when I say we prepare for the worst. You need to have everything even though you don't use it. Along with all this, we also have an anesthetist on standby when needed. Even though hair transplant is a local anesthesia procedure, if he is elderly, if he has diabetes, if he has cardiac issues, we always keep an anesthetist on stand. Till date, we have never had to use him, we never have to do anything, but we still do it for the sake of safety. Now, let us look at our state-of-the-art surgical facility to see what all precautions we take to be safe inside our major OT. Come. So this is our surgical complex. This is what we call the semi-sterile area. Inside there is this full sterile area. Before we go there, I want to show you this. This is our CSSD. CSSD stands for Clean Sterility and Supply Department. This is where we sterilize our instruments. This is a state-of-the-art autoclave machine wherein we sterilize all our instruments to make sure they're perfectly fit and ready for surgery. This is our EtO machine. called an ethylene oxide machine. This is done for specific instruments which cannot handle an autoclave, things made out of plastic, things like that. So we always use state-of-the-art facilities for our instrument sterilization, and we don't take shortcuts. After sterilizing, the instruments are passed through this box into this storeroom. So the store is kept separate from that. Dirty materials come in, they're sterilized, and then they go into this clean room. And from the clean room, they are given to the operation theatre. Now let us have a look inside the OT complex. So you can see we have two major OTs. These are all sterilized as per the best and latest protocols to ensure sterility. Let us have a look inside one of them. This is our major OT. Now how do we stay safe here? One, as I said, we take precautions for sterility in terms of fumigation and autoclaving and sterilization. Second, we have a state-of-the-art general anesthesia station that is equipped to handle anything and everything. Again, we have a defibrillator. For any emergency scenario, this is a state-of-the-art defibrillator that is always charged and ready for every case. And as I mentioned, we have oxygen lines and suction lines all in the walls with our own dedicated cylinder manifold so that we have oxygen throughout. These are the investments we have made to keep you safe. This is a fully modular OT with laminar flow. What that means is you can see these ducts here. Air is taken in through the duct, it goes into the roof and it is filtered, and through a HEPA filter it comes back in. So this is what is called a modular OT, wherein the air is continuously circulated and filtered to ensure that there is no bacteria or viruses in the air. These are all the precautions we go through to make sure that you are safe during your surgery. What about after surgery? What you see here is a ventilator. This is what is used in an ICU to keep people alive. We have a ventilator. Again, our hope is we have never used it till now. We hope we will never use it. It is there as a backup. Surgery safety is all about backups. We have made this investment so that in case there is any issue, we don't waste time putting the patient in an ambulance and shifting them somewhere else. We want to be fully equipped to handle anything and everything within our own facility. And that is why we have invested in this ventilator. Now let us have a look inside one of our patient rooms and see what all we have done there. So this is our patient room. As you can see, it's large, it's spacious, it's comfortable. More importantly, what I want to show you is this. We have an oxygen line and a suction inside every single patient room. So again, if there is an issue, patient doesn't have to be shifted somewhere else. They can be managed then and there. So these are the kind of things that I say wherein it is important to invest in for safety. And many places they take shortcuts to cut costs, thinking that, oh, this will never happen, that will never happen. You don't prepare for things that you think will happen. You prepare for the things that you think won't happen, and that is how you stay safe. So to summarize, at the Venkat Center, we take our responsibility very, very seriously. We understand that when you come to us, you are putting yourself in our hands, and we take that responsibility very seriously. Now, nothing in life is 100%. Every single surgeon does have complications. There's a saying in the surgical fraternity that the only surgeon who doesn't have complications is the surgeon who doesn't operate. Complications are a fact of life, not just surgery. But as a doctor, what we have to do is to minimize those complications and prevent them as much as possible. And that is where we pride ourselves in having one of the lowest complication rates in the industry. And even if a patient does have a complication, we deal with it, we manage it, we're there with the patient until the very end. And most importantly, before every surgery, we talk to the patient about what all the possible complications are, and we allow the patient to make an informed decision. I hope this video helps you understand what all we go through to make sure that your surgery is as safe as possible. If you have any doubts, do write to us. Thank you.